you're touching on some very timely things. Two of them being, I've been pushing a lot lately, wealth extraction, because I tell people they sit around and they don't realize how hard they're working, and more than ever, all their wealth is being pulled away from inflation. And like I was reading a stat that the American dollar's lost 90% of its value since 1950. And so if you compare it to real estate, a lot of people listening to this are real estate investors. If you wanted to increase your net worth, you would need to either bring in more money or decrease what goes out.
Yeah.
And this is kind of what you're saying is, you and I were having a conversation of one of the biggest reasons people will go get a job, or one of the reasons people will maybe take less money, is because they go, well, it's because I'm getting these benefits. I got to get this health insurance covered. And they're either using a lot of their money that they're making, and the majority of it's going towards health insurance, or the majority of it's going towards stuff that they don't really need. So they're taking less money thinking that they need these benefits, or they're paying a lot of money for these benefits that they might not really need to be spending all that. So talk a little bit, because another thing I've been saying a lot of lately is, since the pandemic, man, it's caught on a lot more. But I was definitely an obnoxious kid, like in the sense that I would question things. But I think as an adult, it became almost my superpower. And a lot of it's not to be a jerk, it's because I'm curious. I'm always asking things. I'll go do jujitsu. Well, why this? Why this? Like, because I want to understand, because I'm fascinated by learning. But when people go, because I said so, because it's like, well, that's not really an answer. That makes me think that you're either lying up to no good or don't know the answer. And I think as much as people are not trusting banks, they're not trusting the government post-pandemic, they're also coming around a lot more to not trusting traditional medicine and traditional healthcare. And so I think your timing here is very valid, because we listen, because we've been trained since we were kids and our kids were kids. The doctor knows, the healthcare system's there to protect you, and you listen to what they tell you. And then I just read a stat that the number 3 cause of mortalities in America is misdiagnosis from doctors. So I tell people, just because somebody's a doctor doesn't mean they're good. It's almost like the McDojo. Just because they're a black belt doesn't mean they're a legitimate black belt. So I like that you're dispelling some of the common myths and basically questioning some of the traditional ways that people have looked at modern medicine and modern healthcare. So talk about health insurance. Why do we need it? Is it even worth it? Athletes, entrepreneurs, should we have it? Why do we need it? Is there a better way?
Yeah, I mean, there has to be a better way, right? Because right now we've been pretty much conditioned to say you need healthcare, right? Everybody's like, you need health insurance. And then it's like healthcare and health insurance are two different things, right? So can you get access to healthcare at reasonable rates without health insurance? That's the question. And that's what we hopefully built, and we're hopefully going to try to go forward, where it's beneficial for both the provider and the patient, right? So this is where our crux is. There's a middleman in that. And the middleman is the insurance companies or some kind of administrator, hospital administrator, insurance administrator, plan administrator, which are wedged between providers and patients. So when that happens, you get wealth extraction between those two entities. And wealth extraction comes in two ways in that construct. So the patient pays more or pays a premium, and they give that premium to a pool of money controlled by an administrator. And that administrator will dictate what is medically necessary versus what's not to the provider, which is the doctor, right? Vast majority of the time are these speed bumps in between those two people, which increases the price. So how does it increase the price of healthcare? People say like, oh, the United States has, spends the most on healthcare, but yet they have the worst outcomes. Okay, well, why, right? So why is because of the middlemen doing value extraction, inflating the rates. What happens? You have a person paying a premium and expecting to get all the health benefits from that if they need it. But instead, they set up these roadblocks for them to obstruct and say, all right, we're going to pay money for this whole apparatus to either make it difficult to pay patients or make it difficult for the members to actually use their insurance. So if they say, okay, if we take in premiums and pay out less to people, then we make money. So to the point where Warren Buffett bought United's healthcare stock at like 1.5 billion because he saw the value in it, that their business model is unflawed business model. The balance sheet hasn't changed. The stock went down 50% because they got some bad press since the assassination of the CEO, but nothing's changed on their balance books, right? So it's still a good value if you look at it in a business sense for Warren Buffett. But now it goes to question, does nothing for the community, right? It's not helping anybody, this kind of construct. It's value extracting. So once you have all these people in the middle, you're actually inflating the cost because of what else? The deductible. So if you have a $5,000 deductible, you have to hit those numbers before the insurance company actually starts paying anything. But the way that the numbers is set up is that if you say go for an MRI and you didn't hit your deductible, that MRI facility is going to tell you it's $1,800 to $2,500 for a simple MRI of your back, right? But if you say, hey, I don't have insurance, that number is $600. So they increase the rate, they inflate it 3x in order to eat your deductible. That's increasing the healthcare costs. Not because it costs more, because the way that the finances are structured and to increase maximal value extraction from the member, they increase the rates until you hit your deductible. Once you hit your deductible, then they do something called assignment, where the insurance company and the providers already say, all right, we're only going to give you $350 for this MRI or $600 or $500 for this MRI, right? Because they already met the deductible, but they allow them to essentially gouge the patient at an inflated rate in order to hit their deductible. That's increasing that. Right. And then what increases the cost of healthcare is that the premiums, every time the insurance company increases the premiums, that goes to their bottom line and that increases their stock price. So the issue is with healthcare, it's patients, it's, are at the value extract. So it's profits over patients. So when you talk about these big insurance companies, they answer to their fiduciary, like they answer to their stockholders, right? They're not answering to the people. So this is how, this falsely elevated increase in healthcare dollars, it's a numbers game, right? And so we talk about root cause, right? Doctors are there to keep you sick and all this other stuff. That's a little bit fringe, but they're just not trained like that way, right? So when you go see a rheumatologist or you go see someone because you're getting gout, right? You're getting gouty flare-ups and stuff like this. They're like, okay, we're going to give you this medicine. We're going to give you X, Y, and Z. But they say like, oh, you have to eat better. Don't eat this, this, and this. All right. Doc, thanks. But because of human behavior, you're still going to do all that because our diet really sucks here. So you can eat your processed food and lunch meats and sausages and all these things, but you can eat cleaner. And now, since COVID, people are like, all right, guys, no one's coming to save you. Start eating whole foods, start, losing weight, stop eating all these processed sugars because you got to take care of yourself. And once you start eating less sugar, if you start doing these lifestyle changes, metabolic things change and you may not need gout medicine anymore because you have less flare-ups. So it's this other way of not just throwing pills. I mean, I went to PA school. They went, traditional medicine. It's, again, not a physician, right? Doctors spend more time in a lot of these things, but we were trained, here's a patient, here's their problem, this is how you treat it. And it's all medicine, it's all medication, it's all indicate for surgery, medication, order tests, but we spend little time in lifestyle changes. And it's like, all right, we send you to a nutrition, they spend the time to do it. Or we send you to a nutriopath, or we send you to, which is more and more mainstay now, right? Where they're like, all right, let's talk about diet and exercise more. Let's spend the visit doing that. It's also shifting human behavior. It's a difficult thing to do. So the whole thing with we've been conditioned to say you need benefits, right? But there's ways to be your own boss and not need benefits from an employer. You could do it yourself. And you get a great accountant and it's all like, listen, this is how it's structured. So not every accountant knows you need a business accountant or someone that does, a business management aspect, but you could learn about it yourself. And there's so much information too on the internet that you could type in for ChatGPT and they'll give you a whole construct on how to run your own business and be your own benefit manager and make it very efficient. But there's no constructs like the constructs that we're building in New York City. And this is where we're trying to say, okay, instead of saying pay a premium of $600 to $800 and you're a healthy guy, you're active, you're athletic, no comorbidities, meaning you don't have high blood pressure, cancer, or any of these risks for these things, right? And you say, all right, well, can I get access to healthcare if I don't have insurance? You could, but you'd have to call all these offices. You got to kind of negotiate a rate. You got to do all these running around. Well, we've just made that easier for people where we built this platform where we were already negotiated rates with these providers and they're best in class doctors. You go to these doctors, they're Google reviews or they're, really well-renowned physicians that are still private practice, and we negotiated great rates. So these are my network of doctors for over 20 plus years and all the referrals that we have, word of mouth in the industry that are top tier. So everyone that we sent through that, we get great reviews as far as the doctor was great. Thank you for sending me, because they get it. The arguable aspect of having a private practice doctor taking care of you is because there's shingles on the door. They're going to give you that best care. And if you're paying cash, they understand the pain points and they're like, all right, we're not going to, do this thing just to increase billing on your insurance to see if we can get more money. We're just going to bill you what you need, or we're going to charge you what you need because you're paying cash for it. It just takes out a lot of more fee for service. The providers are happy because they know they're getting paid at the time of the visit versus submitting it to the insurance company, dealing with the approval process, dealing with the reimbursement process, sometimes getting your money, fighting for your money. I mean, it takes more money to do that, to hire staff or hire a third party to get their money back. So the doctors are all happy of having a network of taking a little bit of less of a pay, but they know they're going to get paid at the time they visit, and it's a reasonable price, right? So everybody's happy because it's transparent. It's not like these sticker shocks that you're going to get in the mail thinking your
Mm.
insurance covered it, and all of a sudden here's another bill for $3,000, which makes no sense. So it just decreases the whole anxiety of actually trying to utilize your healthcare insurance. So this is just like, don't use insurance, use this kind of construct where it's a direct pricing through the providers.